Welcome back. This week, we're going to talk about something that we have talked about before. We've talked about Dr. Google in the past on other podcasts, but we're going to talk about it again here because there have been there's some new things written about this whole idea. But it's also something that we see so very often in our office when we're working with families, patients, especially teenagers, where people will, as they experience something, they're feeling something that's either causing some discomfort or something that they don't really like all that much, or they feel is problematic. And the first place they do is they jump onto Google and they type in some of their symptoms, and Google will diagnose them.
Right. Where we've noticed this, and you and I have had this conversation many times, is that people will come in, teenagers through adulthood, will come in, and you can tell by the vocabulary they're using that they have looked this up and they know some of the symptoms. Absolutely. And it's especially problematic in residential treatment centers and other facilities because kids talk to each other and they'll say to each other, just use this phrase, tell them you're going to do this, and you'll get what you want. And so what's happening here is that people are going to the internet. We call it Dr. Google. They go to the internet, they learn a little bit, and they come into the office with a vocabulary that exposes them, that gives them away that they've been looking at this on the internet.
Right.
And so we found this article. We happened to stumble on it. There was a study done recently. The first author was in England, but the second author is in the United States. He works in a medical school in the United States, and they refer to it as Munchausen by internet. But it got us to thinking about how frequently we deal with this in our office, especially in mental health.
Right. Yeah, and so just to kind of clarify some of the vocabulary, because it can get confusing. Munchausen is it's not an official diagnosis. It's not in the DSM or as far as I know, it's not in the ICD, any of the diagnostic manuals or anything. But it's a very common term or vernacular used to describe a person who is engaging in some behavior to appear sick or to become sick with the goal of gaining something. Technically speaking, what Munchausen is the technical diagnosis is factitious disorder. And what a factitious disorder is when somebody is falsifying information, either falsifying that an illness, sometimes creating an illness, like taking things to become sick, or exaggerating symptoms with the goal of gaining something, gaining sympathy, gaining attention, or just getting something. That's called a factitious disorder. And that is differentiated from another similar condition called malingering. Malingering is when you're doing the same thing, you're falsifying information about a condition or a disorder or something, but with the goal of getting out of something. So we see this often in legal cases where a person who is facing a lot of trouble sometimes may falsify symptoms so that they can get a lighter sentence or something if they're seen as incompetent, or if they're seen as having some serious illness or mental health problem or something like that. And so we see malingering there. But again, what we're talking about here is factitious disorder, or what is sometimes referred to as Munchausen syndrome.
Yes. And Munchausen happened to be an 18th century German military officer who was well known for embellishing stories about his life and his experiences and how wonderful he was. And it's his stories are well documented. So when they came up with this disorder, they nicknamed it Munchausen syndrome. or Munchausen disorder, in honor of Baron von Munchausen,
Right.
the
Yeah.
German military officer.
And I think what most people have heard of is Munchausen by proxy.
That's right.
And, right. And so Munchausen is when you're doing it about yourself, like military officer, he was exaggerating about himself so that he can get this attention or this acknowledgement or something from others. Munchausen by proxy, when you add the by proxy, what you're saying is that because of someone else's, you're falsifying someone else's illness with the goal of gaining some attention. So we see this with parents where they will exaggerate or falsify or create sometimes illnesses in their children with the goal of the parent gaining some sympathy or attention. And so that's Munchausen by proxy. It's the same thing. It's still, a factitious disorder, but the person who is considered sick is just another person instead of the person himself.
Right. And I think this is particularly insidious because you're doing it to somebody else. Right. And there are children suffering regularly with parents who have this disorder. And it's very sad because children are made ill. And this, if the parent doesn't get the attention they're seeking, they'll make the child sicker and sicker and sicker. I mean, they'll actually do physical damage. And of course, it goes without saying that it is a form of child abuse.
Absolutely.
And we see it with physical illnesses where kids, intestinal problems or headaches or musculoskeletal problems. But we also see it in mental health, in the mental health arena. Right. And it's especially problematic here because we don't have a lab test. If somebody says, my child has digestive problems, there are lab tests, physical tests that you can conduct. We don't have anything like that in our business. And so in our field, you do rely on the description by other people, either of the patient himself or herself, or a caregiver, a parent or some other caregiver. So you rely on that information, on the observations of others.
Right. And so when that information is coming to us, especially with younger kids, and that information is coming to us from the parent or something, a lot of times these are things that we can't observe because at home or there are things that would not happen outside of the house. We can't observe those things. And so, it becomes really difficult to differentiate between, authentic symptoms and exaggerated or manifested.
And you just assume, I think all of us initially assume that the information we're getting is accurate.
Right.
You just because the challenge is to take all this information and make sense out of it. But then you always have to keep a little part of your brain saying, but this person might be lying to me.
Right.
But it's very difficult because you don't think, at least my first thought is people are coming in here to get the help that they need. So the investment is to be honest. The incentive is to be as honest as possible. But that's not always the case.
Right. And I think that there's a couple of reasons I think why that happens. One is to get some attention and to get some something from someone.
Right.
But I think another reason is that a lot of people just want an answer for why they're feeling the way that they're feeling. And again, we'll get into this some, but as soon as somebody goes onto Google and you type in some symptoms, Google's going to tell you what's wrong. The accuracy of that information is really questionable, as we'll get into. But they want an answer, and so they come in and they present with these symptoms because they feel like this is the answer to what's going on. Now just need help with it, and it may not be what's really going on.
Right. And Irvin Yalom, Yalom, the famous psychoanalyst, wrote a wonderful little book a few years ago called Lying on the Couch. Mm-hmm. And it's double meaning for lying. And in the end, everybody's lying to everybody in his fictional account of this. But it is something that you need to be aware of, that you always need to be in the back of your mind. Am I getting accurate information?
Right. Absolutely. So, what one of the things we want to talk about today is how, a lot of people, again, are identifying themselves as having different conditions, or having various, especially mental health problems, based upon what they're reading on the internet.
Right.
They're going to the internet, they're experiencing something, and they're going to the internet and they're looking these things up, and
Right.
they are diagnosing themselves, basically.
Right.
And what's fascinating is that there may be a couple of symptoms consistent with a particular diagnosis, but then all the rest aren't necessarily consistent until the patient starts to make them consistent, right? The patient starts to say, well, maybe that's happening to me too, and they will start to make the diagnostic criteria fit them instead of saying they fit the criteria.
Exactly. Right. Exactly. It's in reverse.
Right.
They and then they come to you with these clearly articulated symptoms. But that's when you start to suspect that, where did you get this vocabulary?
Right.
Mm-hmm.
Yeah, and it's especially suspicious with teenagers, because teenagers come in with a sometimes with a very sophisticated vocabulary, suggesting that they've had a lot of psychological courses or something, and it's like, how in the world did you learn that word? Recently, we talked about this on a podcast a number of weeks ago, but dissociative episodes, depersonalization, and it's like, we studied psychology. I didn't hear those words until graduate school.
Exactly.
Those words weren't even, we didn't really even talk about that in my undergraduate abnormal psychology course. It wasn't in grad school that I started getting into those, but yet we have, 14 and 15-year-olds that come in and talk about these experiences.
They have those symptoms.
Right.
And there was a raft of those, almost an epidemic of those, a year or so ago, where teenagers were coming in and they were bringing these symptoms in, and they were kind of talking about dissociative disorder, and it became pretty apparent that that at least a subgroup were comparing notes and saying, I think I have this, whatever I'm experiencing, I think it's this. It's a very rare diagnosis. I mean, it's not something you stumble on accidentally.
Right. No, absolutely. And so, when a person is struggling with Munchausen, or this factitious disorder imposed on another, or on themselves, either way, they are, this oftentimes leads to hospitalization. It leads to sometimes unnecessary and potentially harmful treatment. Look, the reality is that when you have a particular condition, the treatment for that condition could be perfectly appropriate, helpful, and help the person recover. If you don't have that condition and you receive that treatment, it can cause you problems.
It causes further harm.
Right. And it can cause harm that isn't necessarily anticipated, which makes it more difficult to get help for the harm that was caused by the unnecessary help. If that makes sense. So a person with this condition, uses these hospitalizations as a way to get that sympathy or attention from other people, especially when it's because their child is ill or something. And they use this to create relationships. They use it to get that attention, and they just thrive off of this.
Most healthcare providers somewhere want to do the right thing for people.
Right.
Okay? And so it's an easy group. Excuse me. Take over.
Oh, okay. Well,
it's sinus season.
Yes. Drink your coffee to help. But you're right. The healthcare providers are really, if we want to call it this way, easy targets for this, because they really want to help the patient. They want to help the family. They want to be attentive, provide the care that's needed. And so when they have this, parent, for example, coming in that is in great distress, and they're really struggling with what's going on, the physician or healthcare provider is going to give them lots of attention, be as supportive as they can, which is then going to, reinforce on the person with this, condition to continue to, exaggerate or talk about these things. And so it's this vicious cycle where the person is getting what they want, the attention and sympathy and everything that they want. And the healthcare provider is oftentimes, doing everything they can to try to figure out what's happening, but not feeling like they're making any progress.
Right. When you go into a hospital, you're going to get the attention of doctors and nurses.
Yeah.
I mean, there are people who are going to be attending to you. And for a person who has a pathological need for attention, this is a perfect place to go, because you're going to command attention when you're in a hospital setting. But there's another issue that we're dealing with today, and that's a GoFundMe account.
Right.
Because now, years ago, it was just attention. Today, you can get money for this sort of thing, and we're going to talk about that with the last one, is that you set up a GoFundMe account, you have this story of how sick you are, how sick your child is, and people are doing this, and people are being prosecuted for starting GoFundMe accounts for individuals who are sick, or individuals who say their children are sick.
Right. When they're not really sick.
When they're not really sick, right?
Yeah. So yeah, we have this sort of it's such a complicated and challenging situation, because you don't want to make the assumption that someone is lying. If the child is sick, or if the person is sick and has problems, you want to provide the treatment. But at the same time, you have to continue to be vigilant to make sure that what's happening makes sense based upon what you're seeing and what's being reported. So that, in the event that something is being falsified, that you identify that and protect the person who is the patient.
Yeah, especially when it's done to others, and others can be a child, or it can be the elderly. We're seeing the same thing now with elderly patients. Caregivers will sometimes use this to gain attention by putting an elderly person at risk, just as we see with children.
Right. And they do it in lots of different ways. Sometimes you just flat out lie about the symptoms. There have been reports of people, altering or changing lab diagnostic tests, like contaminating urine samples and blood samples and things like that, falsifying medical records. Some of the big ones are, when a person will even poison or suffocate or intentionally cause an infection on another person. And, they do so thinking that they're controlling it, because typically they don't, want the other person to die or anything like that, but yet they are, they're causing these illnesses and this sickness on this person.
You think of how complicated medical care is, and yet one of the things that people will do is, blood in the urine, an infection. And so you have to make sure that the blood in the urine is the same blood type as the person, as the patient, and I'm thinking, who would have thought it,
Right.
Who would have thought to check to make sure it's that person's blood?
Right. So it leaves the physician or the healthcare provider being a sort of wearing multiple detective hats. They're wearing the detective hat to figure out what's going on with the patient from the illness perspective. But they also have to be a detective, to see like how many hospitalizations has this person had.
That's right.
How typical or atypical are the symptoms, and are they consistent with what we would expect and what we typically see in these situations?
Right. And years ago it was a little bit easier, because if you worked in you and I both worked in hospitals, and you'd get a patient, regardless of age, and the chart would be enormous.
Yeah.
Be real thick, because before electronic medical records, and you'd have a paper chart, and it would be huge, and right away that would send off
Right.
alarms, because you would say, well, this person's either really sick or it could be Munchausen,
Right.
either Munchausen or Munchausen by proxy.
Right. Yeah, it would, we had those charts that were multiple volumes.
Or there'd be 2 volumes. Yeah.
1 of 3, 2 of 3, 3 of 3. And the kid's only 8 years old, and it's like,
Right.
wow.
Something. Yeah, but it's a little harder now because you might not see the entire record. It could be in storage somewhere.
Right. And what's also difficult is that there are, and this is sort of the pros and cons of the way that things are now, is that there are so many providers that a person,
That's
another
right.
thing that you often see is, sort of doctor shopping, where the person will go to different doctors looking for something, looking for,
Right.
either a new perspective, a new relationship, some renewed interest or engagement from someone. And so because of that, you may not always, when a person's building insurance, it helps because there's a common thread of
The
building
record.
insurance. But a lot of times these folks don't use insurance.
That's right. If you're not using insurance.
And so there's no connection between all of these. And so you could just say, we've never seen anyone before, and there's no way to verify that.
Exactly. Right. So in this particular article that we ran into, the persons targeted were doulas, DOULA. I learned about doulas because I have relatives who live in California, and doulas this was more than 20 years ago. And I first learned about doulas from them because they were very popular. And a doula is sort of it's not a medical professional. You don't really need a license to be a doula. It's more of emotional support. It's a person who's present, can be present at birth, or during an illness, or for palliative care. It's just a person who's there to provide support, which makes the doula a very easy target for hoaxers.
Right.
Okay? Because they are by nature caring and giving and attention giving, sympathy giving. And so doulas have become a target for factitious disorders.
Right.
Okay. Right. And so the woman who did this study, she's a physician in England, and they interviewed a number of doulas, and they present 5 cases where doulas were drawn in. Now, the issue here is that they were drawn in during the pandemic because you couldn't see somebody in person.
Right.
And so it was easier to do this over the internet because you never really were in the same room with the patient.
Right. Yeah. And so they became, like you said, easy targets. But it's not just doulas, right? It was, healthcare providers and professionals in general, because it takes, it's sometimes hard to explain. It's difficult to go from, oh my gosh, this person is really experiencing some really difficult things in life, I want to help them, to, I think this person is like taking this. I think it's really difficult to make that shift.
Right.
Now, once you make that, and I know that you and we've had a couple of experiences dealing with this with former patients, but it takes a long time to get to that point, because you have to really monitor and look over time. And so again, when you're thinking about dealing with this via the internet, virtual sessions, and during a pandemic, it would be really difficult to go from, let me help, to being suspicious.
That's right. And we're talking about this article happens to be talking about doulas, but this could be any healthcare provider.
Right.
And I think that as therapists, we're especially susceptible.
Right.
By nature, we want to do the right thing. We want to listen. We want to understand. We want to work with people. But if somebody chooses to present inaccurate information, it's going to be very difficult to tease that out.
Right.
And I think of difficult teenagers and how easy it is for parents to blame the child.
Hmm.
You know, that the parent is presenting information
Right.
and you assume that it's accurate, but you don't know whether the parent, what if the parent is provoking the child
Right.
to have these? You're not going to know
Absolutely.
because you're not there.
Absolutely. And you know, in the past, it was maybe a little bit easier because we did house calls, and you know,
Right.
as healthcare providers, we could go into the home and see some of those things.
Mhm.
We don't really have the opportunity, and many people don't have the willingness really to
Right.
do that anymore. But also, you know, in the past, medical information was somewhat protected in the past. And when I say protected, it's like you had to go through some hoops to get to that
Mhm.
information. You would have to go to
Right.
medical libraries and medical schools and things like that to get information about
Right.
what does this condition look like. And
Mhm.
now, and this is why we titled the podcast, you know, Munchausen by Google, is that you go into Google and you can type in you can get whatever you want. And it's so problematic because there have been research studies to suggest that, you know, a massive percentage, I think it's something like 40, 75 or 80% of diagnoses made based upon what it says on Google, what you know,
Mhm.
what you
Mhm.
get through the search engines, is wrong.
Right.
Um, and people will rely on that because, Richard, remember back, and this was in the aughts, in the 2000s, when we were writing our parenting book, but at the same time we were working on that rating scale, the pediatric
Right.
tutor rating scale, and
Mhm.
there were books that were coming out about childhood onset bipolar disorder.
Right.
And I'll never forget that there was a book out that was considered the book to read about it. And it said, you know, if your child has any of these symptoms, it could be early onset bipolar disorder. And again, Rich, you're smiling already because I know that you remember this. There was everything listed from
Mhm.
wetting the bed to preferring sugar and candy to rages to, I mean, there was, I think it was a page and a half or 2 pages of symptoms, honestly, that every child just about experiences.
I remember you saying any kid could have this. You were shocked. So any kid could have this disorder, right?
Any kid. And so, and the same thing happens when you go into Google and you start typing in some things,
Yeah.
you get this laundry list of things. And yes, sometimes those things are consistent with
Mhm.
the diagnosis. But my goodness, if all you're experiencing is, you know, if you feel like you go from being happy one minute to being tearful the next minute, and you type that in,
Mhm.
you're going to be diagnosed by Google with bipolar disorder
Right. That's right.
because you have mood swings.
Right.
Now, that's not at all what bipolar disorder is,
Right.
but that's what you're going to get because of what you're typing in. And so the readiness and availability of all of this information is really concerning because it just contributes to
Right.
To a lot of this.
Right. And as you say, there was a time when you had to go to medical libraries and you really had to do a lot of research.
Right.
Today, you don't need to do that. You don't need to do that anymore. It's all right there on the internet. So, but I think any healthcare provider is going to be susceptible to this, to patients coming in and either not giving accurate information or giving symptom, the vocabulary of symptoms,
Mhm.
where they're coming in and it sounds, and it's obvious that they've been on Google or some other website, and they have the vocabulary. And I think it's particularly problematic for teenagers because teenagers are wondering about these things anyway. It's completely normal for teenagers to think that they have any number of disorders. I can remember my daughter when she was a young kid saying, "Dad, I have bipolar." She called it bipolar disorder. And I don't think you have bipolar, but they're aware. They're aware of the symptoms. And you know, when the other thing I was thinking about, when you take a psychology class, your first psychology class, and you go through the different disorders and you think, oh, I think I have that. I think I
Right.
have this. And it's common among medical
Mhm.
students in medical school because they hear these disorders and diseases and suddenly they think they have everything.
Right. Or they start diagnosing all their family members with things.
That's
Yeah.
a lot of fun.
Yeah, exactly.
Okay.
But you're right. There are articles and things out there to help clinicians try to
Right.
uncover hoaxers or people who may be doing some of this stuff. And yeah, one of the main things that we can do to try to identify this is just to look at consistency. If a person is presenting with information that just isn't consistent with what we would expect with a particular condition,
Right.
then that's a warning sign. Or what I really what's really suspicious, of course, is when a person comes in with actual printouts from the internet. It's like, oh,
I haven't had that one yet.
yeah, I've had that a couple of times. But it's, again, it could be completely valid. There is valid information on the internet. And so a person could be completely honest and appropriate with some of these things. But at the same time, if it's just inconsistent, that's when those red flags go up.
Right. Yeah. And so all healthcare providers need to be aware that it's happening. It's always happened. Goodness, you and I had a case of Munchausen Munchausen by proxy back in the early 2000s.
Mm-hmm.
A young child who was an elementary school age child.
Yeah.
And the issue there was one of the parents wanted him to have a mental health condition. And
severe.
Right. And there was some concern that the child probably didn't have any condition, let alone the one that was being proposed. And this parent happened to go to a number of providers in this area to try to get somebody to confirm it. And
Right.
she would just go from person to person. And finally, she ended up in our office,
Right.
the parent and the child. And it was pretty clear that the child didn't really have a serious illness,
Right.
but the mother was using that, I think, in part to get custody of the child. I think that was another issue there. But yeah, it was a complicated mess and caused this kid a lot of, and he was on medications that he didn't really need to take.
Right.
So it was sort of a sad case because the child was being adversely affected. He didn't know any better. He thought his mother was telling him the truth.
Absolutely. And I think that that the underlying message that there's sort of a twofold message with this podcast, I guess. First, for clinicians, we have to be vigilant and we have to be mindful of what our patients are presenting with, and to be again, vigilant in making sure that we're looking for those consistencies and inconsistencies in presentation. Right. Typically speaking, patients don't go from their deathbed to a miraculous recovery, back to their deathbed, back to a miraculous recovery. Patients don't go from you're treating one illness and everything is great, and all of a sudden now they have this other dire illness. Right as you're cutting back sessions and stuff, now all of a sudden they're deathly ill again. Those kinds of things don't typically happen. They sometimes happen, but they don't typically happen. And so we have to, it raises red flags. I think that the other side of this is, I think there are sometimes when people are experiencing something and they're genuinely concerned and worried about it, even parents about their kids, and they go onto Google and they search for things. And again, they make the presentation, they make their symptoms or behaviors or anything fit a diagnosis.
Right.
I strongly believe in the power of naming things, right? And so when you're experiencing something and you give it a name, like anxiety or bipolar disorder or
Right.
depersonalization. It then becomes that. And so you take on that that identity, and now you all that confirmatory bias, you're looking for examples to demonstrate, yep, that's in fact what I have. I do have bipolar disorder because look, this keeps happening and that keeps happening. And it creates this shift in the person themselves where they start to really believe that that's what they have. It's not just a factitious thing. It's like they truly believe that they are, but it's because of incorrect information that they're getting online.
Right.
So you have to be really mindful of where you're getting information from.
Right. And as always, these, especially in mental health, it's always far more complicated than a list of symptoms. I mean, and that's the other thing that everybody needs to recognize, that first of all, the people come in, anybody comes in here, they come in with what we call a presenting complaint.
Right.
Okay, this is what I'm experiencing, but that may not be the real problem.
Right.
So the problem you hear about may not be the real problem.
Right.
Okay, but even if it is, it's not something, it's making the decision about if a person has something and what the person might have is a complicated decision that you don't just match what you hear with a set of symptoms. You have to dig a little deeper and go after what's really going on. And that takes time. I mean, it takes more than a visit or two. I always say that, I mean, I'd like to think that I could do this in a single visit, but you can't. It takes time to peel away the different layers to finally get to the diagnosis. You don't just match these symptoms with a list of symptoms that you can get on the internet.
Absolutely. And it absolutely takes time. And the thing that I often teach, when I'm teaching my grad students and stuff, one of the things I often say is like every symptom, every characteristic that we attribute to a mental health condition, from anxiety symptoms to hallucinations,
right?
All of those symptoms are perfectly normal under certain circumstances.
They exist.
They're not a mental health disorder.
Right.
They're universally, people experience hallucinations when they're on certain medications. A lot of people, when they come off of anesthesia, for example, they will experience hallucinations. It's perfectly normal for that to happen. Then, I mean, it's distressing, but it's not schizophrenia.
Right.
Exactly. So every and it's perfectly normal for 8-year-olds or 6-year-olds to talk about imaginary friends and have full conversations with them, but it's not typical for a 16-year-old or a 15-year-old to do that. So there are behaviors that are perfectly normal at some times in our life or under certain circumstances that are diagnostic under other circumstances.
Exactly.
So it requires a lot more than just looking at a set of symptoms.
Exactly. And I think that's the take-home message here, is that whether you're presenting symptoms or you're the healthcare provider hearing the symptoms, it's going to be far more complicated than a list of symptoms.
Absolutely.
You can't just rely on those.
Absolutely. So if you feel like you're experiencing something or your child is experiencing something, instead of heading straight to Google, maybe go to the, search and find a mental health provider nearby that can help you and kind of explore things with you a little bit more.
Right. Yeah. The symptoms are a decent starting point, but they're just a starting point.
Absolutely. So, all right. Well, that's it for today. Until next time, stay happy, stay healthy, and forget to be afraid.